Yes, call my cell. I will have it on silent, but when you call in, I'll just hook you right on up to my microphone. Good. We're live now, so I'm just waiting for people to sign up and come in. We have 7 attendees so far, so they're starting to log in. Okay, I'm assuming I'm connected to everybody. You ready, guys? Ready to begin? I hope so. We're going to go ahead and start. We have about 23 of the 57 people registered. Hi, I'm Trip Brad at Sky Family Practice. I want to welcome you to our knowledge-based webinar. And you'll have to forgive me if I look off of camera to the screens as I'm trying to kind of be the administrator for this also. Kristen Dutter has very nicely agreed to, oh, hello, there's following me. Isn't that interesting? Well, let's just go ahead and stop that. All right, there we go. But Kristen has agreed to help with this. As you know, Kristen Dutter has been a power user for some time. And she has developed her knowledge base for her practice. Ripon Family Physicians, if you see family practice on anything, I incorrectly typed it in. So please forgive me on that. Pretty soon we'll wait for a few other people to come in. Please feel free to chat if you're connected. You should have a chat on the right-hand part of the bar. This is how we do things, and then we'll be doing some other things later that will be fairly exciting. Just as chatter talk before we begin, and I get comfortable, we have been here at Skyline Family Practice here since 1993. I've been in practice since 82. I was in the National Service Corps for 2 years in North Carolina, and then came up to this area in Front Royal, which is 70 miles due west of DC, in the beautiful Shenandoah Valley, and was with another practice, left that practice, went into the ER for a couple of years since I've been doing that for a long time. If you will, paratrooping into ERs to bail them out from time to time over the years with an ER company. So I went into that full time for 2 years and then started this practice in '94 on April 10th. Yeah. And actually I had the luxury of setting everything up. So the day we opened, we had 500 patients registered. My dear wife, through an answer machine in our house, had collected 500 patients through ads in the newspaper, the old way of doing things. And we started with 500 patients that day and have grown ever since. As some of you may or may not know, you're looking at the sole physician now at Skyline Family Practice. I am unfortunately by myself, except for a nurse practitioner who I'm very happy to have here, Sarah Wigand, who joined us. Now it's Sarah Chrisman. She got married and went off to South Africa for a couple of weeks on a photo safari and has a lot of neat pictures of leopards. Sorry, I won't be showing some of the wild game that she photographed, but hopefully you'll enjoy this. The two other physicians left. The first one, interestingly, left due to meaningful use. Here I was a proponent of it and served on a federal advisory committee. As it turned out, Bernard Pegas, very intelligent guy, just got tired of the bureaucracy, more from a libertarian perspective, and he left, and he's a hospitalist. And then Barbara, my other partner who'd been with me for 15 years, essentially was a solo mom. Her husband, although they were happily married, was always away, and she was trying to run home and take care of a kind of special needs kid. Wonderful child. And I think with having to cover for a 3-physician practice, she just decided to work for the VA of all things. So we've had doctors going everywhere, but we have a nurse practitioner coming in June. I'm very excited about that. And by the way, we are recruiting for physicians, and certainly we'd love to entertain anybody who's interested in family practice, even med peds, and who knows, internal medicine or peds, if you like that idea, in this beautiful area. We've had about as many people sign up as we're going to right now, so people will log on as we go. Remember, use the, let's see if I can do this. It should be over here on the chat room thing. There is no telephone number. Let me write my answer to that. I'll explain that. So you'll use your speakers and a microphone if you have one, hopefully. I'm not sure how we're going to work that out. I'll explain a little bit about how we do that as we go. As I said, I'm not exactly the world's leading webinar person, so if things are a little quirky, you can blame me. Anyway, let's begin, if you will. What I'm going to do now is I'm going to share the screen, and I'm going to get over to what I hope to be a PowerPoint presentation. There we go. And let's begin, if we will. Gratuitously, I'm going to introduce my newest grandchild, Abel Ray Kimmel. Here are the stats. Saturday, he was born 8 pounds, 10 ounces to Erica, my daughter, and her husband, Danny, who have been happily married now for a year. They're wanted to have a kid, and they just went right to it. And that's our 5th grandchild. Jan is, in fact, today up in Winchester, getting ready to, or actually not getting ready, but actually helping Erica and being a great grandmom as usual. He's a cute little booger. Back to a question someone had on the chat, which I just realized I put no telephone, choose your speakers. Please choose your speakers. Anyway, the Webinar Jam is the platform we're using. It seems to be a good platform, and the reason why they didn't go with telephones is that actually affected some of the quality with regard to the audio. Hopefully the audio is good for you all, and the other thing is it actually allowed for more things to the right, as you will note, the chat area. Hopefully, we'll see here, that should go away. We'll go ahead and take that off, move overlay, since we're up and running. But Webinar Jam is a pretty neat platform, which we'll hopefully use in the future. And so with my apologies for anyone who's used to the telephone, this saves us cost, or AKA me. Certainly there are other webinar processes, but this has no ads. If you'll note, anymeeting.com is a good one, but it has ads all over the place. And this is just a purer form of a webinar, if you will. Let's see if I can do the next slide. Well, that's interesting, isn't it? Here we go. So without further ado, I'm going to introduce Kristen. She'll sign on later and take over control of the presentation, I'm hoping. We tried to work this out yesterday, and that's Ripon Family Physicians. So please bear with this slight typo as we went into this. As I said, she's a power user. She's a very good speaker, has spoke at many user group meetings and does quite well. That's me, of course. One of the things I'm going to talk a little bit about is Don Stewart. He has been a stalwart as far as being a practice partner user, and I'm going to call him practice partner user emeritus. He is actually going to be speaking on the knowledge base. He can't be on this call today, but he will be at a Clyde Bennett and Associates, or Aldridge, I guess is the new name, user group meeting in Austin in June of 2015. And he'll be speaking just before I do on Saturday, I believe, June. Let me look at the schedule. That'll be June 20th. PPRNet, which is now called Primary Care Practice Research Network, has well over 250 practices that contribute to the data that PPRNet has given to the United States and beyond. They have done studies such as colorectal cancer research, depression research, alcohol overuse and abuse research, studies with hypertension, standing orders, which has been a real game changer. In fact, was featured on the AHRQ, that is the Agency for Health Quality and Research website, with Steve Johnson, one of our fellow practice partner users, but also medication safety, which has actually been key to some of the other quality initiatives that have happened federally. So we've had an impact nationally. The meeting is in Charleston. There is a cruise. Kristen Dutter, I must say, has been an advocate for the cruise. And probably, as I haven't spoken to her, but I venture to say she is on the cruise and registered and ready to go. That's right before this meeting, which is towards the end of August. If you have a paper and pencil, it's at the actual website, which I didn't put on here, is www.musc.edu/PPRnet, and they'll get you right to their website. I can't tell you enough where other things have come and gone. Practice Partner Research Network, or excuse me, now Practice Primary Care, or Primary Care Practice Research Network, I'm still making conversion, has been there. I was there for the first meeting in Seattle in 1995, and it is now in its 20th year, and this will be the 20th year celebration. So if you can make it to Charleston in August, a little muggy, but it is a lot of fun, and Charleston's a wonderful travel destination. I will also say that the EMR Village, if this is really in the concept of the villages for everyone. We really want staff. Certainly, Kristen's an advocate as an administrator at Ripon Family Physicians, but we want staff involved. We've had secretaries, front office staff, nurse clinicians, nurses of all types, PAs, non-physicians and administrators, IT administrators. In fact, some of the bloggers are IT folks. So please feel free to interact on that. That is the fruition of a process of developing our online community since, if you will, 1998, when we started using CompuServe for a listserv. And so please, come on. I'm going to go over the agenda real briefly. We've had the welcome and announcements, the brief introductions. I'm going to go over I'm going to actually have or inject a video on the knowledge base, and then I'm going to take you on a tour, if time permits, of our knowledge base. But more importantly, we'll have Q&A after mine, and then more important, a tour of Ripon Family Physicians knowledge base with Kristen will do, and she'll give you some techniques. And actually, their development of their knowledge base is in an earlier stage than ours, since we've been doing it since 2001. So she's really used it very well, and then we'll be closing it out. The knowledge base is something that isn't a new idea, and I thought Dr. Osler, the person we admire, I thought he said this: if you don't have to know everything, you just have to know where to find it. And actually, I found out that this person, Sofonisba Breckenridge from Kentucky, she was an educator, actually may be attributed to this with after checking the web. But the fact is, the knowledge base is something that you have. It's there, and actually, at this point, if anybody, someone just chatted and said, "Are we starting soon?" Well, we've been going here. Hopefully, there's no problem. But I will give a USB thumb drive to anybody who knows what this is. And at this point, I'd ask you to sort of see if you can figure out what that is. I'll give you a little time. If anyone gives me the name, I'll be more than happy to let them know what it is. And of course, we'll have the USB thumb drive. Well, anyone knows what that is? All right, there's a thumb drive on the line. It is a Memex. This is a concept of a machine proffered by Vannevar Bush in 1945, and the idea was to have repetitive information immediately available. Yeah. Someone said, was it a fax machine? Good try. Sorry, the time was up. Alex Trebek already cut me off on that one. So nice try, Pat. I appreciate that. But this is actually what it is. It was just a concept. It really wasn't really created. But the idea was to have more, as knowledge became more available, this was a way of getting to look at a lot of information. And if you look at it and you think about it, there's the desktop right there. People could actually access stuff. That's the end of that part of the show. And what I'm going to do now is go over to what I hope will be. There we go. What I'm going to do is inject a video, hopefully that will load here at this point. Well. I'm sorry. I'm hopefully the video is showing, but it doesn't seem to want to play. Let me see if I can get this going. I apologize for any technical problems. Okay. We do try. The thing shows it as being going through, but let me just go ahead and end the video. Okay. My apologies. I was supposed to have, it just happens this way. Well, I'll tell you what. Let me just talk about it, and then we can go. Well, actually, if I can get that injected, I'll go ahead and do it. It's not wanting to play either, so forgive me. I give up. I had a nice little video that went over the actual processes and involved with this. On the EMR Village is a reasonably nice, although somewhat dated, 2005 video. In fact, it had Floyd Landis in there, which we were heralding, but unfortunately, as a cyclist, he was doping too. So anyway, it's a great video that sort of goes over a lot of the knowledge base. It's been around since 2000, since version 7.05a, and it worked very well. And we were the first, Practice Partner was the first to use this in an EMR. In fact, the video did reference an article in the Journal of Family Practice Management called Develop Your Own Intranet, which I think came out in 2003, which tells you how to do that. I'll certainly create more materials since we're having troubles with the video. And what I'm going to do now, hopefully, with a little bit of luck, is share my screen, and we can go from there. And maybe I can sort of fill in where the actual injected video was supposed to work. So having said that, let me share the screen. And hopefully I'll have Practice Partner up here in just a moment. What? Oh. Is it showing the video? Well, hush my puppies. Okay. Well, we try. You should see at this point, again, my apologies for anything that doesn't work. We try our best. This is actually a small screen. Don't worry, we will work on getting the actual knowledge base. But as you know, you can actually access the knowledge base. Here I am trying to access it that way. You can access the knowledge base by hitting task and going to the knowledge base here. That brings it up with a little bit of luck. Okay. And you will now see, I'm going to share the actual knowledge base so you can see that since it's a different window. And again, I apologize for the craziness of all this. You know, it's amazing how things work really well when you don't have to worry about webinars and things. I'm assuming, are you all seeing that? I'm just going to go ahead and get that going. I'm getting ahead of myself as usual. All right, I'll get rid of that. I'm going to share this again and hope that I get this for you. There we go. All right. Are you all seeing the practice? And again, my apologies for any craziness that's happening now. Okay. Thank you. You guys should now, thank you very much for your feedback. You should see, or I'm hoping you see, the knowledge base. So I'm going to try and share that with you. Again, I apologize as I switch back and forth. There we go. Well, you'll have to forgive me. It's not like I do this every day, but what I'm trying to do, obviously, is I'm going to get this and maximize the screen. There we go. That's what I'm talking about. All right, so this is our, and just bear with me. This is actually our screen. Don't worry, I'm going to hopefully make this bigger for you. This is our home page. And hopefully it shows fairly large for you so you can actually see it. The concept here is to keep it within a certain number of pixels, which normally would be 640 by 480, which is considered a half page, just like a newspaper. And you really want to have everything connected, you know, every document or resource connected by 1 or 2 clicks. Although the tab up here, if you'll notice, is patient resources, you'll see staff resources, clinician resources, and references. This actually is a misnomer in this tab because it actually shows many more things than that. We have staff resources, clinician resources, and references. And you'd say, how the heck did you develop this? Well, we did this with, I did this with Dreamweaver. Coffee Cup HTML editor is a very inexpensive and usable one. Dreamweaver is a higher end. What you see is what you get. HTML editor. But you remember, I've been doing this for 14 years or so. So it isn't that you should feel like you have to do this. In fact, Kristen's going to show you a very nice process. I'm going to move on a little bit and show you some of the resources just as we've set it up. As I mentioned, this is a high frequency page because these things are somewhat buried, as I just mentioned, by clicks. But we have things like diets, which are right here, and we'll just make them bigger, won't we? And so you can actually access things very quickly, get right to what you need, and if you need a clear, a reflux diet, you got it. If you need other things, you got that. So we have other consents are a good example of a lot of things that we do. Well, not accessing it, but we'll just kind of go through this if we can. Let me go down here because this is our real active resource area for our staff. I'll be very quick here. We have a refill protocol, which should come up. There it is. And the nice thing about that, you can just see how it kind of goes through. And the nice thing about that is if you hit Control F, right, and you type in Flexeril, you go right down to it. That's a nice way of searching on any web page, by the way. And if you want to find out if, for instance, oh heck, let's go up a little bit. I'm sorry, I hope I don't create any. There's gabapentin right there if you want to find out if there's a refill protocol for it. So, basically, this has been a game changer for us in terms of being able to, for me to survive. Another thing that's really helped is we have other things for educational purposes. That is the physician monitoring program for controlled substances. That's a document on how to record it into Practice Partner. If we have and this is the other thing I'm going to talk about briefly because we don't have a lot of time left, but I use Evernote. Evernote is a cross-platform information knowledge base, if you will, that you can add snippets of everything. And interestingly, you can share things. So if I have a change in anything related to protocols, they know to go here. Oh, look, and I can change it actually very quickly. So what I will do actually is I'm going to bring up, you should still see that. Okay, well, now you're in here. So let's just go, let's do Epic because I know that'll probably bring it up. Neat thing about this is there it is. And the nice thing about this is I can change this in Evernote anywhere I am, including my cell phone. And once I sync it, it actually goes directly to this, which is a web URL. And if we renew that, we should see, oh, Kristen's no longer there. But it actually has any updates on the protocols that we may want to have. Chronic care management is an active process that we have. So if they want to look at that, and the dog of hospital systems, Epic, sorry to anybody who uses Epic, my condolences. We have some things in here to sort of help guide scanning, etc. So a very useful process with regard to, changing things very quickly. Policy procedure updates, the same thing as an Evernote page. Right now, chronic care management is a big thing that we're doing. Oops. And as you can see, it does a lot of things. We actually, and this is a concept that I want to give to you, why have a Rolodex when you can actually go for all your referring physicians that you have at specialty centers, when you just link up to their physician find homepage. Let's just, for instance, go, I don't know, Children's National Medical Center, right? There it is, find a provider. Why? And then he's the featured one, John Snyder, but you can go find the specialists. The neat thing about that, and I think UVA does a pretty good job, hopefully. Okay. So let's just pretend, this is a very simple thing to do. Hopefully he's there. Well, that's just wonderful. Anyway, you can actually find the doctors, but the concept is there. It works very well. And when you print it out, it usually has their phone number. You give that to the patient with their, CV, and they actually bond to the patient. The patient bonds with, the actual physician, and they can call them if it snows. They can call and cancel the appointment. So that works pretty well. Again, we have a lot of things in here. I'll just link in here. Of course, some people have seen this. This is the book which we use for staff training. And so it's there for our staff. Oh, that guy's pretty upset. But anyway, it talks a lot about how to set it up, the concepts. And so really the knowledge base is there to sort of sync up, if you will, our staff too. As you can see here, we can bring up the PPRNet patient level report, and actually our, of course, it's an older report, but it actually has the process sheets on how we've done on various things. So powerful. It's available to any of the clinicians and the staff, so it works out really pretty well. The staff resources are also very helpful. And in fact, we'll see if this works. Yep. This is actually, well, this is a cold fusion based process, but this is their schedule. This is a schedule for the nursing staff, which Jan, as the nurse manager, can change and add, so they can see at a drop of a hat where their schedule is. These things are available. I'm going to turn this over in the interest of time, to Kristen, and we're going to try and do that. But as you can see, there are lots of different things you can do and use with the knowledge base. Now, what I'm going to try and do, I'm going to stop. There we go. I'm going to see if Kristen can present. So with little, I wonder if anyone has any questions if they want. Okay. And that might be somebody I know. Is that you, Kristen? I'm going to put her on speaker so she can actually, this is our high-tech way of making this work. I'm going to hopefully unmute her, I hope, but actually have her present to everyone. So she should be shortly presenting. At this point, you should see, okay, and I think you figured it out. Okay, good. Yep. Yeah, everybody sees your screen, I think. Are you a practice partner, right?
So I was just going to take everyone on a little tour of our knowledge base. Are you hearing me okay audio-wise? Because I can't see your chats at this point.
Yeah, it looks like you're getting it because I'm seeing some.
Okay. So stop me if I need to slow down. To get to our knowledge base, I'm just going to go to task and knowledge base. And while you just saw Tripp's very elegant version, ours is very basic, and it was very self-taught just by reading the help files in Practice Partner. So here is emergency supplies and phone numbers, easily accessible with one click. And then we have it grouped here. Some of these things link to other documents. Most of these are just Word documents that I saved as single file web pages so that they could be visible here. And I'm going to show you, if we have some time, how I did that. But things like health maintenance standing orders for some of the vaccines. Here's one I'm just going to open up real quickly. And it just created some standing orders for a variety of things that the checkout and referral girls needed. So things like ordering certain lab testing when it's requested by a radiologist, like if you need to make sure their kidney functions are okay before they have a CT with contrast. Certain things required for reclass infusions or patients with annual eye exams, things that maybe don't fall into the health maintenance standing orders, is a useful thing for our checkout staff here. So that's just one example. And it's just a quick way. People don't have to pull out a piece of paper. It's right there in the system. Health maintenance standing orders. Let's see if I can pull that up. It's kind of small there, but you can kind of see just the standing orders for our health maintenance items. And
Kristen, if you hit Control Plus, that'll bring it up when you're in a web-based thing.
Okay. Okay. Let me go back then and just show you a few other things. Office policies. So just a variety of different protocols and policies are grouped here. With the measles epidemic at Disneyland, we had some information about that. It landed in this file. And then patient handouts, kind of like the patient resources that Tripp was showing. And there's a variety of things. One thing I like in this screen, you can change the view and sort it by list I'm not sure that is that big enough for y'all to see. Trip, can you see that okay?
I think the concept is visual, but yeah, it's a
Okay.
little bit fine. So.
Let me switch back then to medium icons, and I'll show you. It might have things like handouts about fish oil or niacin or Mediterranean diets. You can see different stretches, just a lot of different things that we have found, whether it's web pages or documents we've created in Word. So I think it might be useful, aside from showing you all of the different things we have in here, to show you how I did this. One more I'll show you quickly would be a link that takes you, instead of to a variety of files, straight to a web page. So for anyone on the call who has never set up their knowledge base and doesn't know where it's contained, I'm going to just try to show you here quickly. If you go to your PPART folder, there's a folder called KBase, and this is where you have folders set up that contain the documents that you want to show. So maybe looking at patient handouts, this is where I'm saving them so that they're visible in our knowledge base. So again, that's PPART, knowledge base, and then the folders you have. To actually create this, if you have a Word document open and you say File, Save As, and you just change this to the type of a single file web page or an HTML page, and then you save it in that folder that I just showed you in PPART knowledge base in the appropriate folder. That's how I'm getting documents there. So you may have a variety of Word files or Excel files or any kind of file that you want to save there. As long as you can save it as a single file web page, you'll be able to put it there rather than have to hand it out to everybody on paper. Did I show that okay, Trip? Does that illustrate
that's
kind
perfect.
of how you make a Word document and you put it into your knowledge base? To change the actual home page of the knowledge base, you, instead of going to the knowledge base folder, once you are in PPART, I believe it's home.practicepartner, and I've made a couple copies here. I think the live one is home.practicepartner.html. So if I open that, this is where I would actually change the face of the knowledge base when people first open it, kind of the home page that they first see before clicking these links. So it kind of shows what's contained in it, but here's where I would make any changes to that. Am I explaining that okay, Trip?
Yeah, that's fine. And actually, you can configure that to a different one. Maybe I can show that later.
Okay. So that's kind of just a quick showing you the difference between a nice, elegant version from someone who knows how to create HTML and use, what did you say, Dreamweaver? All those things that I don't know how to do, but I know how to use Word, and so I can create files and save them as single file web pages within the existing knowledge base. So I really took what Practice Partner shipped to me and then just began to add on to that. It's certainly, I was sitting here as Trip was talking and making lots of notes of good ideas he's put in his that I want to go back and rework mine. But this is kind of a starting point for you, hopefully. Is there anything else you want me to show, or do you want to...
Actually, maybe what I can do is show people how they can move the home.practicepartner.html to a different place, perhaps.
Okay, let me stop sharing mine, and I'll give it back to you.
So far, we've been doing okay. All right. I'm just going to do that, and I should be okay. There I am. You've seen our highly technical transfer the information from Kristen. I'm going to leave her on my phone line, and she can add things as she wishes. She'll just say, "Excuse me, Trip." Anyway, what I'm going to hopefully show you. I think that's the right screen. I'm really working hard. Yep, that's it. So what I'm going to do here is maximize that. Hopefully. That's most interesting. All right. So as we get going here, I don't know if you can see it, but, and I'm going to try and maximize, but I think we're having some cascading problems with this, but in any case, with the knowledge base, you'll see how you set it up, and hopefully Let me bring that up into screen. Here it is. Right, I don't know if you can see at the top, and this is, I have it maximized, so just bear with me. Come on. But what you'll see in maintenance right here is set defaults, which is at the very top. It's a little small, I apologize. But here is where under administration default settings, you actually set up your default homepage for your website, but also your knowledge base. And you'll see that mine is a little bit different. And I apologize for the inability of Practice Partner to be enlarged, but in my case, I have it in a subdirectory, which is called PPART intranet, and that's where my home Practice Partner HTML index page is. The reason why we did it was in the early phases of this whole process, our support from PMSI and then McKesson would sit there and say, well, you need to restore from backup, and we just wiped out your PPART directory. Of course, besides having to change my depends, which I have learned to do when I have support on the line, you know, don't wear them otherwise. You know, I basically at that point decided that we need to put it in a subdirectory. And in fact, what I'll do, as Kristen has done, I think it's a good practice. What I'm going to try and do is bring up how we have our directory set up. There's Practice Partner, or PPART, sorry, and you can see. All right, and I'm going to try. I don't know if I can. You know, that would be too easy, wouldn't it? Right here is intranet, which is in a subdirectory, and you can see over time we've created a bunch of different subdirectories. We have one for the staff documents, and we have one for, she says, carry on, thank you. That's where this goes back a long way, and it goes into a lot of stuff. One of the concepts that I wanted to tell you about, which is wonderful, and I think, you know, this is where this is where we put our vaccine consents. Well, guess what? You know, we have a web page just for that, which is right here. And hopefully you can see it. Again, we're going to make it bigger. Although I must say that we don't use everything in here all the time, but it's kind of nice to pull up the vaccine information statement for a more recent one that's updated now. And there it is. You know, our Tdap vaccine is available immediately within our knowledge base so that we have it available, so we don't have to go find the file. The key is, if you have to go to a file cabinet or some stash for documents, you don't need to do that. You need to create a subdirectory for vaccine consents. This is a federal requirement, right? So if I need to, you know, get my meningococcal vaccine, and then you just sit there and say print, and then you do your print thing, right? You print it off and print as many things as you want. And you'd usually do it at the site in the room if you can. We have printers in every room. Why? Because we don't want to leave the room. We leave the room, we get inefficient. That's I think a critical concept for a lot of folks. This has been very helpful. And actually, unfortunately, we have a refusal form, you know, which we have some people sign, frankly. I think, and I believe, like Jamie Lohr, you don't just discharge people because they don't do vaccines. Sometimes, I must say, if they get angry or impolite, then they hit the road. But you really try. We've won over a few folks, which has made a big difference. And as I mentioned, we have other patient handouts. And here's the concept that I wanted to show you with this in particular. And again, hopefully you can see that pretty well. We have lots of stuff here. And the thing about that is, you know, and it's not alphabetical, I'm sorry to say, but we just got tired of telling people how to set up ergonomics for their workplace. There it is, right? Tells them how to do it. this came out of all things Computer Shopper a long time ago. I scanned it by a scanner into the, and made it a PDF, I think. And as a result, we have something we print out. The neat thing about it is we tell people to bring it back to their employer, and it has our name on it, right? So it helps us help the patient get the stuff done that they need. This is a concept, of course, this is kind of advanced, but we use instant medical history quite a bit. And since we have emails, we just type that in there, and then this will send actually an email with COPD, let's say for follow-up, and you have an appointment, and it actually will send an email. This is Cold Fusion application, so I'm not going to spend much time on it. It is fairly well developed, but we are working with Matthew Ferrante and Alan Winter on that. This is we just hook up MD Consult so you can actually get in there. Oh, interesting. Well, they're doing things again as usual. All right. Well, isn't that interesting? All right. So anyway, that's MD Consult, for instance. I'm sorry, I meant to say up to date. So everyone has a membership, right? But sometimes you have to, hopefully, well, you can get in there anyway. The Family Practice Notebook is a knowledge base. And I thank you, Kristen, for going through that. So we have a lot of things here. Like I said, we're still moving forward with all this stuff. And again, just making things available. Here's a good example of using a decision tool that actually, again, this is HTML based, but this allows us to add the information on a particular patient, right? So Kristen has been a chain smoker for years. I guess you guys didn't know that. And she really looks a lot younger than her stated 65 years. She stopped at 58. That means she stopped back when it was 2008. If we, and as we set this, here we go. Well, let me just, Jane, let's just pick on Jane. Stopped at age 48. And this is something that Robert Pierce developed. But again, as you get better at it, you can actually move forward with it. And then you've copied it to clipboard, which actually triggers this whole thing. And you've created these clinical elements. You can actually put it right into the chart and their guidelines, etc. So really, from that perspective, a lot of things. Here's another good example of a good use. And I'm going to make it larger. And you'd say, why do we want to do this? Well, here's one that unfortunately some of our patients use. And if they're destitute or somehow don't have it, they can go to the Canadian Drug Store and get, this is a pretty reliable source for cheap drugs. Why the United States subsidizes the rest of the world, I'll never know, but that's one you can do. And actually, you can hook up to the Walmart web link, right? And with the patient behind you, you can look up the medicines. And again, remember, Control F is a wonderful way of looking up stuff. So let's see. Oh, I don't know. Is allopurinol on here? Well, let's just use metformin. Okay, metformin. You didn't want to tool through here. There it is right there. So these people can get, for $10 in any Walmart in the United States, 90 days worth of metformin. An interesting point brought to me by Michael Hennigan, who is now, I think, working for Lilly. He said, hey, have people go to Walmart for the cheap drugs so they don't reach their donut hole quite as fast, which is an interesting concept. And tell them not to even bring out their insurance card, of course, which Walmart will do. They'll ask you, do you have your insurance card? By doing that, of course, they'll file it and it goes right to their donut hole or donut. And of course, you can see it's a little dated since Kmart's not here, but you can go to Target, which is not working. All right. but you can do so many things and get to things. And of course, we use, we'll just get out of there since that's acting quirky. One of the things that I wanted to show you, of course, this has been a big thing, and unfortunately, we have to deal with it more than I'd like, is our controlled substance use contract. We use one. It's on the file sharing part of the EMR Village, by the way, and it's designed to hold them accountable in lots of different ways. Anybody who gets any medicine beyond the first one, let's say, if I do a vasectomy on a patient and I give them Vicodin, not that they need it because I do such a good job, right? We give them a controlled substance use contract, and they have to abide by that. We hold them accountable to it, and it's been very helpful. So there's absolutely no limit to the number of things you can do with things. I hope you guys have found this fairly useful. Kristen, do you have anything to add? I think you're still on my phone call. Well, you've been texting me. Bear with me. Are there any questions in chat that you want to ask? We'll leave some time for people to chat away. Eventually, we'll work on, if we have mics and everything, we'll let people kind of ask questions that way if they want to. As I said, we have folks still on the line, so if you have questions, feel free to ask them. I'm going to see if I lost Kristen. I don't know if I did or not. I think I did. Oh, you're there. You're a quiet little person.
Well, I put you on mute so you didn't hear yourself back.
Patrick asks, is there a way to pass PPR information from, I can actually demonstrate that if you'd like, Patrick. That's an interesting question. Let me broadcast that. Let me show you how to do that. It's actually quite involved. There's a lot of traffic and there's a lot of information in I think the file sharing part on how to do that. But you basically use a URL-based process to take letter codes, and then you can pass them using JavaScript to the knowledge base. So I'll show you a simple one that I may be able to demonstrate. Let me just bring up. And hopefully, the problem, of course, is our friendly neighborhood. There's partner. Let's see here. Where are you? Oh, I got out of it. All right. So you would, I'm going to have to put you down, Kristen. So let me do that here. Let me get in here and show you how that happens. This is a concept that we helped develop with Robert Pierce. He brought it to a new, refined process. Let me show you. In fact, I'll show you a form, and I'm going to get back to the web sharing. Let me show you. Kristen, I think you did this too, if I recall correctly. Let me see if I can bring it up. All right. So with all due respect to this whole process here, I'm gonna bring up Jane set up our patient, right? And I'm just gonna make her large, and I don't know if I can. Yeah, I don't think I can. Actually, what I'll do is once I get into Progress Note, I think I can make it larger. Bear with me. And there is a way to do it, and we'll make it 250%. So there is, we have, just bring up quick text, so bear with me. And I'll show you the quick text in a moment. All right, there we go. So we have an action, we use dot action for action codes that we use a lot. If we want to do a sleep study, here it is. Now, you'll see this link right here. The action is arrange sleep study, print sleep study and note, and finish based on note. We don't have to do that, but this is actually part of the note. This triggers opening up this, and I'll show you this. This is actually a P-link using a link to this form right here. Oops. All right. I didn't mean to do that. I'm going to exit out. Bye-bye. But you can see right here the sleep study form, and then F name equals, this would be F first name, letter code, last name setup, date of birth, provider. These are all JavaScript associated things. And so watch what happens with this form, which is a fairly involved one. And I'm going to try and make this enlarged. But I may have to make it smaller so I can allow. So that, of course, PDF doesn't like to use JavaScript unless you allow it. So let me open up that. Well, where to go? Well, until I'm not used to navigating this stuff. All right, we'll just, there it is. I don't know if you can see it, but this filled out the form totally. With the patient's phone number, alternate number, their address. All I have to do is hit excessive sleep. This is a PDF form. This is using, Adobe. It puts their insurance company in there, their social security number, their insurance policy, which they wanted. It puts the current date in there. And actually, I'm going to work on putting the printed name, UPIN, and everything else. And so all we have to do is then print it. I don't know if this is an amazing process. Again, Robert brought it to a new level, and I actually adapted it to, I hate to order sleep studies because I have to fill out everything, but if I don't have to worry about it, it's kind of nice to be able to go in here and just have it all fill it out automatically. And I think that's what Patrick was talking about. Did I answer that okay? Kristen?
As far as how I would actually, I understand the concept of what it's doing, but how I would actually set this up to create my own forms that would pull data is something I'm not familiar with doing. So
sure. So what I will
probably do a whole webinar on how to do that.
Yeah, but this is, yeah, exactly. And so in the few
I think what you showed is that the concept is there and that it can be done.
Yeah, well, let me just pull up edit. We'll just take .ac. Show how it works. Search. All right.
Patrick says yes, you answered his question.
Oh, okay. Well, that's good.
Christy's asking if this webinar is available for later viewing. Are we recording this trip?
Yes, this will be recorded. It'll be available. We will send it. And actually, if there's some other way of doing it other than the Webinar Jam website, I will do it and we'll make it work. Somebody had a question, maybe? A request. All right. Christy had a request. Oh, okay. I'm going to invite Christy to, she had a request, so we'll see if we can see if we got that. I don't know if this will work or not. Christy, do you have a question? Yeah, maybe it won't work. Anyway, we're running short on time. As I said, we could probably talk. I could talk for a long time on this. I started presenting to user group meetings back in 2003 on this, and then of course other people have done wonderful jobs before and since. So, and Kristen did a wonderful job of showing you how you can very quickly make it a usable part of the practice partner. It's if you will, it's a clean palette, and you're the artist. So, we're always available before and after on the listserv if you have questions. Kristen, do you have anything to add?
There's just a few more things popping up in chat.
Oh.
You might want to address a couple of those questions.
And
one thing I was wondering is there any way, Trip, that we can share our knowledge base information with each other?
Absolutely.
I know I could screenshot it, but it'd be awesome if I could say, look, here's my documents, and I want you to be able to view them, and same for you to share yours.
Well, guess
possible?
what? And I'll just describe it. I won't try to show it because then I have to put you down, and you're so valuable on the phone. In the file sharing part of the EMR Village is a section called knowledge base, and the controlled substance use contracts there. How you set up WebView is there. Documents you may want to use, you're welcome to copy them. I think everybody who puts them on there realizes there's no copyright. Plagiarism is okay. That's what the EMR Village was designed to do. And also the EMR Village forum has stuff on it too. But the file sharing site, which Pat Matzner from Kachina Family Practice oversees and helps me administrate, does a wonderful job of working with that and helping people with questions. It's a separate login. You can get there, but the documents can be uploaded very easily by anybody. So it works pretty well.
So let me just jump in and say, if anyone's on the call that's not on the EMR Village, be sure to get on, and then also get access to that file sharing site. Not only can we share the documents we use in our knowledge base, but there's a lot of other resources in that file sharing site that I have found so useful, and I've pulled from so many other users in the community, and it's made a big difference in our practice. So I'd love to see all of us on the call kind of revitalize that, add some new data, and I'll try to do my part and upload some of the files that we use there for you guys to have access to.
Yeah, I'd say that too, Kristen. I'm learning. I'm learning how to do things from other people. Robert Pierce has taught me a lot. Don Stewart, Kristen Dutter.
Believe it or not.
Well, really. Well, that's just it. Someone's thought becomes a great idea that everyone uses, and we build on that. There's a question from Patrick asking, do I prefer an HTML editor other than MS Word or Dreamweaver? Let me talk a little bit about Microsoft Word. It creates a lot of dirty code from my perspective, since I'm into HTML coding, but it does a very useful job of creating HTML. Coffee Cup HTML editor, which if you just Google that, has a very reasonable, what you see is what you get, and then you can also turn it over to the code, and that works very well. Heck, you can use Notepad to do HTML, but the Coffee Cup HTML editor, I have used some, and that works very well. And it's a lot less expensive than Dreamweaver, although the Adobe products now have a monthly kind of subscription, so you don't have to pay, heck, I don't know, $600 or something like that, which is outrageous.
Sure, there's one other question a little further down I think we may have missed. Do you see that on your screen?
How do I set up or link decision tools and calculators? Is it on the EMR Village? Do I need PPR Helper for this, or is there another way to link these to charts? If so, yeah, calculators are interesting birds because they are basically JavaScript, which HTML uses. Robert Pierce, when he was with us, developed a lot of calculators because his son basically was going through college doing computer stuff, and of course Robert got very facile with it. They're there. Actually, they're on the file sharing site. They're still very functional, and basically what you do is you let the HTML page do the calculating, and then the way he has it set up is you click a button which copies it to clipboard, and then you just drop it in by using Control-V or paste. And then, based on how you've set up, let's say, clinical elements or lab or what have you, it'll actually drop it in there for you to use. And, Robert, one thing that he was very good at was documentation. So he usually has, and Kristen, correct me if I'm wrong, a document that usually goes with that to show you how to do it.
Yeah, and I think to answer your second question there, Archie, is you don't need Practice Partner Helper, PP Helper, for the link decision tools. I think those were two separate tools he created. Am I right on that, Trip? He has PP Helper, which does a variety of things, and then he has Link Decision Tools.
Yes,
they're independent of each other.
Yes, he can use. I think PP Helper can actually link them in there, which he wanted to do, but no, you don't need those at all. In fact, I don't use PP Helper at all. For me, it's a distraction, but you have to understand. I've been using this program since it was a blue screen in '93, so you know. Some people like PP Helper. A lot of people like some of the features because he has some pop-up killers that work. It's sort of outside of the discussion, but certainly he has a very nice document that explains how to use it, which I've read, and it seems to be very nice. Yes.
Yeah, and if there's anyone on the call who doesn't know what we're talking about, that's also on the EMR Village and file sharing site. We do use PP Helper, and it's configurable. So there's parts of it we use, and then there's parts of it we don't like. And you can just minimize or turn those features off. But there's a lot of shortcuts it provides, and that was just, again, like Trip's been saying, something a user came up with that he shared with everyone. So
yeah,
check it out on the EMR Village.
So there are people on this call who are still there. There are 20 people, I think, at this point. You know, really, for you diehards who've hung on here for an hour and some odd minutes, hour and 11 minutes now, I thank you. And I would encourage you, everybody's idea is a good idea. And, you know, we all have gotten better at what we do. Wouldn't you say, Kristen, that Practice Partner or, you know, the end user group and some of the VARs out there, Clyde and others, have been very instrumental in, you know, building on knowledge that was heretofore never available. So, and we do that by helping each other. So, yep. Okay, I don't see any more chats. Kristen, I want to thank you very much. And actually, Mick mentioned something about advanced users for HTML home site as a good product. I think that, you know, I looked at that. It seems to be a good HTML-based product. I don't think, if there are any other questions, Kristen and I are certainly available. And if you're on the listserv, our address is, at least on the first posting that we have, if we ever post, show our email addresses. And I would say anybody on the listserv recognizes that they make themselves available to help individuals off lists. So wouldn't you agree, Kristen?
Absolutely.
Okay, great.
And I can share my my email in the chats here. So if anybody has any questions for me later, you're welcome to send that to me. Give me a second, I'll type it in here.
All right, I can type with one hand. I've been hunting pecked in a while, but well, that doesn't work. I'm actually currently at, although my my service provider is currently deciding to push us over to Google. There's mine also. So if you all ever need help to that end, we will. And, you know, really even more useful sometimes is posting it out to the listserv, because there are other people who may have even better ideas than we do. Well, with that being said, and thank you, Sharon, and thank you. We look forward to hearing what you guys have to say. There'll be I think, a survey to ask how, you know, if you have any improvements, and we'll see you all on the listserv in the EMR Village and PPRNet. Thank you. Bye, guys.